I love to talk about things that are free, cheap, low cost, no cost. And so that's one of the reasons that they asked me to talk to you about our competency project today, because we were able to implement it at very low cost, and you can do the very same in your county. So I think we could all agree that people with mental illness are in your jails too long, and they are costly to you in many areas. Your medication budget's high, there's slowdowns in court, you have competency issues, so it's incredibly costly. And the data I looked at, and I'll just have to kind of tell you, is that the number of individuals going to the state hospital and being found incompetent is continuing to increase. So last year we had about 55 individuals in our county alone that had to go to the state hospital or were found to be incompetent. So we had to find a way to reduce those days because, as you all know, many of the people who were going to max security were spending over 400 days in the jail waiting to get transported. Are any of the other counties seeing this? Or just, yeah, all of us. So we want the same thing you want. We want a cheap alternative or just an alternative sometimes in how we're going to deal with these cases that are filling up the jails. So I looked at the average days it was taking to transport someone to the state jail. When I started, it was taking roughly about 43 days to transport somebody to the state jail. And in the last year, it took 30 days. So I started thinking about it. And it was also taking us a great amount of time from the time we decided maybe there's a competency issue until we disposed of that case. The time that it took from someone to come back from the state hospital and have their case disposed was about 85 days when I started. Last year, it was at 23 days to resolve those cases. Now, that's a lot of money. And it's a lot of time they're not in your jail, maybe getting new offenses because they're still very ill or things of that nature. So I simply started thinking about all the time we were losing waiting on our county employees, our staff, our jail personnel, our attorneys to do paperwork. And so that's where I thought we could save some money. And when the state hospital decides that someone has regained competency and they need to be returned to your county, anybody know how you find out? How does the state hospital tell you? Nobody knows? They send you a letter in the U.S. mail. U.S. mail hasn't gotten any faster. So it wastes between 5 and 7 days from the state hospital mail that letter to you, and it go through your mail room and go to the court and go to the clerk, and then everybody contacts the attorneys to decide when people can schedule to come. So those are the areas I attacked. And our county sent a directive to every state hospital in Texas and named me the point person for the county and instructed those hospitals to give all notice to us via electronic means. So they email or they fax. So right there, we shaved roughly 10 days off every one of these cases. And that's easy. We also looked at moving the cases a little faster. So in our county, I watch every one of these cases. And I make sure that when they're coming back, instead of calling the attorneys and saying, hey, what day are y'all free? The judges have authorized me to say, I need you in court in 2 days. That person's coming back, you need to be in court, we need to take care of this. So we shave about another week off going back and forth between people asking how everybody's schedule looks. And some people might say, well, that's not right. You need to consider people's schedules. But in 4 years of doing it this way, I've only had twice that an attorney's asked to reschedule due to a conflict. So it's not a problem to handle these cases this way. By doing these little things, we are shaving off time that they're sitting in your jail. And you can do this as well. So roughly, it ends up being a little bit over 100 days per case through all these means that we've implemented to expedite. And it's very simple. You need a point of contact. You need the sheriff to commit to picking up the individuals as soon as you get notice, not 14 days later. You need the bench warrants issued timely, and you need the judge to commit that the cases will be promptly heard in the court. And once they come back, the judge would instruct all the attorneys that this case isn't going to get passed out in the hallway. That's how most of the time the attorneys pass the cases, is the defense and the state out in the hall and agree that where they're going to change, reset the date. In our county, the judges require that they appear before the court before a competency case is reset. So those are very simple, low-cost changes that you can make in your county to start saving some money on these cases and focusing on what's happening with them. We also initiate in-custody injections on court-ordered cases. There is a statute that says if that person has been ordered to a state hospital for competency restoration, that they can be court-ordered to take meds if the criteria is met, but your jail medical must be willing to give those injections. Any of you have individuals coming back from competency restoration that have deteriorated and you've had to send them back? That should not be happening. That court order for meds allows you at the jail to continue those court-ordered meds for up to 180 days or till that case is disposed. So there's no reason somebody should return to your jail and deteriorate if they came in with a med order. You've just got to make sure that's part of your medical contract and that those things are being completed. And those are so very simple. So, if you want to go back and make a change, talk about where your point person can be. Talk about who can be assigned to get these emails and notify the state agencies and hospitals that that's how you're going to handle it in your county, and get that buy-in and commitment from your judges and from your sheriff to handle these things right away, and you'll start seeing an impact in your county. I think I've got just a second if anybody has questions about any of it that I could answer for you. That's super easy. That way I can pass it off and I'll hang around afterward. And if we can offer any direction or more information on some of the cost savings that would help you implement in your county, we're always happy to do so. Thank you.
Alyse, thank you for that. There are some common sense solutions for those of us in rural counties. And one of the points that Alyse made was, I'm using the word point twice, but that point of contact person can be critical in saving money for the counties. If you can have one person that follows them from magistration and that first 1622 order all the way through, you just won't believe how much money and time it will save your county. And to you county judges in here, you might look at the Texas Association of Counties websites. There might still be some grant funds available to use to give those defendants returning from hospitals those much needed, sometimes very expensive medications. I think that grant is still available, so check that website. And so what my friend Kirk and I are here to talk about is just another practical solution that any county can do, and that's stakeholder meetings. And I know that you keep hearing about these stakeholder meetings, but many people come to me or call me, email at me and say, I have no idea how to get these people together. It's a great idea, but I don't know who to get together. I don't know how to get them together. And it's something that's just so simple. And it takes a little effort to begin with, but don't give up. Your first meeting might only have 2 or 3 people, but if you just keep on working at it, then you'll find that more people will begin to engage. They'll understand the importance and the value of it. Also, just throwing out a little thing, I'm on another board, and it's for community resource centers. These are rural centers that are trying to bring together agencies that provide services in the area, such as your WIC office, your indigent health, your food stamps, your food pantries, bringing them into one building in the county to serve the needs of all of those people that might need those things. Because in rural counties, one of our biggest problems is transportation. And if we can put those all under one roof, it's a little bit easier for them to access those, and they could possibly even access your public defender's office, your LMHA. So if you want more information about how to establish a community resource center, let me know, because that's something also that could save your county a lot of money. I'm going to turn this over to Judge Noaker now, and he's going to talk to you about how you can set up those stakeholder meetings. And we didn't rely on a PowerPoint, thank goodness, and so the handout that you've been given is directly associated with that. Thank you, folks.
You know, when I go to trainings across the state of Texas, and if I'm giving training, one of the things that I've always found a little frustrating, and perhaps some of you can relate with me on this, is that if coming from a small county, when I hear Harris County and Tarrant County and Dallas County tell me how they do it, sometimes it's a little frustrating because we look at the resources that they have and we think, golly, well, if we just had a little bit more money, we could do that too. And then sometimes we may throw our hands up and just say, well, it's impossible. We can't do that. Well, I can tell you that we can do some of these things. The handout that was just distributed to you, if you want to go ahead and give that a look at that wheel. Don't necessarily focus in the middle of the wheel, but look at the wheel. And I know that on that wheel, each of us in here have a resource that's mentioned on that wheel. In fact, I suspect most of us have all of those resources on the wheel. What we need to do, if we're in the ground stages or beginning stages of trying to set up that collaborative network of people that really give a damn about mental health in our counties, look at the wheel, and we need to identify who is the hub of that wheel. I can tell you in Burnett County, we have a full-time magistrate judge, and that would be me. It makes most sense for Burnett County that perhaps I be the middle of that wheel. I can give you an example, almost a chronological timeline of what happens in Burnett County when we have a criminal defendant come in. And that criminal defendant may suffer from some type of a mental health illness. Of course, there's going to be that statutory jail notification to the magistrate within 12 hours. I receive that magistrate and I liken it to an air traffic controller that is a bloop on our radar screen. I get to the jail, I hear somebody screaming in a cell, I go to this booking staff, I ask questions, what's going on with him? I get a verbal report from them. They give me an idea of what they just had to deal with all night with this defendant. I go into my office, I look at the criminal charges, I look at a history with the defendant, I may reach out to my LMHA, the local mental health authority, and I might ask some questions about this defendant's background. Hey, has this person been in services by chance? Have they had an assessment, now called interview, in the last year? Why do I care if it's within the last year? Well, that is one of those exceptions to a 1622. If they've had an assessment in the last year, you don't have to go that 1622 route. That doesn't really necessarily rid you of any responsibility when it comes to providing some services for the defendant. But when it comes to a 1622 order, you wouldn't have to order it. I get that information. I'll probably go cell side, observe the defendant. I may have an exchange with the defendant. I introduce myself. Hey, you know, how you feeling? How you doing? Sometimes it's obvious. I don't really have to hear their answer to that. I'll ask them questions. Where do you live? Are you working right now? And of course, I'm asking very generic, basic questions of them because I'm trying to get a feel, where are they at? If I'm hearing some things that are a little off the wall, I may want to go that route of 1622 or continued communications with my LMHA. I'll then go back into my office. I may very well issue a 1622 order, and then I put that order on blast. I communicate not only with the LMHA, but I communicate with the jail. I'll have a default appointment to our local public defender's office, and I send a notification to them immediately. Because if I have somebody that suffers from a mental health illness, generally I will do a default appointment when it comes to an indigency hearing, and I'll appoint the Burnett County Public Defender's Office, and I'll let them know. It's quite possible that I might reach out to our mental health deputies, because it's also possible that this defendant may very well be eligible for 17032. Do we all know what that is? We should after yesterday. That is the mandatory PR bond, a personal bond for that defendant if they suffer from a mental health illness and if they are void of certain acts of violence in a criminal history in their past. What I'm doing is I'm pulling all of these resources that we're seeing on the wheel, and I'm essentially staffing them with respect to this particular defendant. We all have the ability to do this. Some of these resources may not be available, but it's possible that in your jurisdiction you have more resources that we don't. It can be a social service agency. It can be a religious institution. Just think of all the people that you can bring to these stakeholder meetings because they care about what's going on in our community. That's the beauty of this. That's the beauty of 500 people attending this mental health conference today. There's 500 professionals out there in Texas, and I assure you that there's many more than that, that care about where we stand in mental health in the state of Texas. Well, your community is certainly no different than that. There's tons of people that want to have a role and that may very well be useful to you in the criminal justice system as we move forward. So as we all broke out in our rural track meetings yesterday, we all met with our LMHA, and I think it was the catchment area for all of our LMHAs. And I can tell you ours, and our LMHA happens to be Bluebonnet Trails, it was a wonderful experience. It was neat because I only know Bluebonnet Trails from a Burnett County perspective. But then I have all these rich people over there in Williamson County telling me what they do with Bluebonnet Trails, and it was really fascinating to listen to. And then I have some other counties that may be similar to Burnett County or even a little bit smaller than Burnett County talk about what they do with Bluebonnet Trails, and it was like an epiphany. I thought we talk about having stakeholder meetings, but generally we limit those stakeholder meetings to our jurisdiction. And yesterday we walked away with this sense of, why don't we have some stakeholder meetings that fall within the catchment area of our LMHA? So in other words, we talk about some of the things that we do in Burnett County, and we care what Williamson County's doing, and though we may not be able to have the resources, the financial wherewithal to accomplish what Williamson County does, I've discovered that not all things require money. It requires passion, it requires determination and advocacy and persistence. Judge Nelson said, don't give up. You might have a couple people at that first meeting, but you keep having those meetings and you will find that group, the level of people that care and that are interested and that might have something to offer, grow. So yesterday we walked away with that, from that meeting thinking, oh my goodness, I want to hear what Williamson County's doing. I want to hear what Bastrop's doing. I want to hear what some of these other counties in Bluebonnet's catchment area, I want to know what they're doing. We may not be able to walk that same path, but I like hearing some of the objectives. You'll find that you'll probably learn a lot from what you're hearing from these jurisdictions outside of where we're at. So when you get a chance, look at the wheel. You may very well have something in place right now. But I can assure you what's super important if you're going to be successful in tackling mental health is you need to identify who's at the hub of the wheel. It can be any of those stakeholders. It can be somebody outside of that wheel, and you'll look at the corner, I think we have like a county judge there. I know some of the really small counties, it may very well be that county judge that's the hub of the wheel. But whoever that hub is, they have to be persistent, determined, and they have to advocate on behalf of mental health. I mean, that's really why we're all here. I mean, we heard stories yesterday. We hear from all of the speakers. Clearly, we care about what's going on in our community, and I think we all recognize that this nation is in a mental health crisis. We talk about the opioid crisis, and we talk about a lot of other things. Sometimes I'm concerned that we, in the mental health community at least, are being a little drowned out. So let's be a voice for what we're trying to accomplish. Thank you.